All right, the Facebook stream should be starting. I'll bring your slide up. Is that the page you wanted?
It should be the title page. Nope. Yep. Thank you.
Okay.
And I'll just text when to start and stop sharing. Does that work?
Correct.
Hi, everyone. We're going to give it a couple of minutes just to make sure that people who want to join us on Facebook Live have time to log on. Thank you all for joining us to How to Access Services During COVID. Okay, we're going to go ahead and get started with our presentation for today on how to access services during COVID. My name is Maren Lujan, and I work for Austin Public Health. I facilitate the Austin-Travis County Community Health Plan on behalf of Austin Public Health. The Austin-Travis County Community Health Plan is a collaborative planning effort with public health providers and service providers from throughout the Austin-Travis County area to make sure that they're meeting community needs. Today, we know that our community members are struggling with the impacts of the pandemic, and so we wanted to make sure that we're informing them about services that are available to them during this time. A lot of our partners, their work has been refocused to address a lot of the issues that are being faced right now because of the pandemic, and so we wanted to make sure that people have access to that information. I will be going panelist by panelist and topic by topic. We will be covering a multitude of different services available, including where testing for COVID-19 can be accessed, food assistance, rental and utility assistance, healthcare, mental health care, and substance use disorders. So for our first panelist, I'd like to introduce Dr. Elizabeth Douglas with Dell Medical School. She is an assistant professor in the Department of Internal Medicine at Dell Medical School, and she specializes in infectious diseases.
Thank you.
Go ahead, Dr. Douglas.
Yes. Yeah. Did you have a question for me? Hi. Thank you for inviting me.
No, if you want to go ahead and present on the different topics that you were going to touch on about prevention and treatment of COVID-19, hospital capacity and supplies, what to do if you have symptoms, what to do if you test positive, etc.
Well, thank you for inviting me. I think this is a really important time to talk about COVID, as it's really affecting us very severely in the city right now. I'd like to talk a little bit about what's going on in the hospital. As we've seen in the news, there's many more infections and also many hospitalizations. And this is really creating a very critical situation because we're trying to expand our hospital capacity, but certainly the numbers are very, very large. And not to create any sense of panic, but it's so important that we try to slow down the spread of COVID because the resources that we utilize in the hospital are not limitless. We certainly can increase the amount of beds we have, but each bed has to have medical staff, nursing staff, doctors, specialists, case managers, and that's a finite number. So it's really, really important that we do what we can to stop the spread. And I believe it's in the power of Austinites, which did a great job kind of flattening the curve. So talking a little bit back in the beginning, what happens when you think you have symptoms or when you think you have COVID? It's really important that you talk to your doctor, but probably the first thing that needs to be done, I know that we'll be talking about testing, certainly getting a test, but number one is if you have any of the symptoms of COVID, which can be headache, sore throat, chest pain, cough, nausea, vomiting and diarrhea and fever, any of those symptoms, you should sort of assume you could have COVID and isolate yourself. This is very important. You don't want to wait till you have a positive result to isolate yourself, because unfortunately, as the burden of testing keeps going up, the time to get a test result might be, 3 to 5 to 7 days, depending on where you get the test. So that's really important that you isolate yourself from your family and really stay away as best you can. And reach if you have any symptoms, again, I'm talking about the medical resources, the hospitals are getting full, but if anybody has any symptoms that are critical, chest pain, shortness of breath, we want you to come to the hospital. Not only for COVID symptoms, but we want you to come to the hospital if you're having critical symptoms. What we've seen, unfortunately, during this epidemic is a lot of people are so fearful to go to the hospital that they've stayed home with heart attacks or strokes. So I really want to highlight that, the hospital is available and it is safe. But that's primarily the message I wanted to share, is that, this is really, we're entering sort of an emergency situation right now, and we need to try to decrease the spread and take all the precautions that we've been talking about, wearing face masks, maintaining that social distance, and staying home. We need to go back to stay home like we did in March. And if we have to go out, we have to wear a face mask. But it's really important that we slow the spread.
Thank you, Dr. Douglas. I did want to highlight that Austin Public Health is offering testing, and you can access that at austintexas.gov. And Community Care is also sharing, will also be sharing testing site information. So our next panelist is Isela Guerra. Oh, and there's the information with the testing. Thank you. Our next panelist is Isela Guerra. She is a community outreach supervisor at Central Health, and she's been with the organization since 2009. In her current role, she educates the community on the Medical Access Program and other enterprise programs, and she seeks to create partnerships with organizations that serve similar populations. Isela, if you want to go ahead.
Yes. Good morning. Thank you so much for having me. As Maren mentioned, my name is Isela Guerra. I'm with Central Health. And I just wanted to join and share some information about the Medical Access Program, MAP, as it's commonly known. It is still available, and because of COVID-19, we have switched application processes to online. We have a website. It's www.applyformap.net, and you can fill out the MAP application online and submit your documentation all electronically, but also we are able to enroll by phone. So if you'd rather call and start your application that way, then you would call our 512-978-8130 phone number. So enrollment is continuing throughout COVID, and it's very important that people do have access to primary care, to their prescription medications, and emergency services, especially right now. And I also wanted to share some information about Community Care, who's our enterprise partner. They have about 7 testing sites throughout Travis County. And they have a variety of locations. But starting Monday, June 26th, their hours of operation on those testing sites will be 6:30 a.m. to 1, and that's just because of the rise in temperatures. But just to make everyone aware, they are experiencing a high volume of testing. So what we'd really like to share is that if you do have your own primary care provider, you have established relationship with a doctor, or your own private health insurance, then please call your primary care provider first for any testing or symptoms. And that way we can keep access to testing for our most vulnerable populations, those individuals without health insurance or without an established primary care provider. And then another update from Community Care is their North Central Clinic on Breaker Lane, 1210 West Breaker Lane, now has a pharmacy. So if you are needing prescriptions and you're in that North Austin area, Community Care does have a pharmacy in their location. During this time, we're trying to continue our operations as normal and accessible as possible. Of course, we're all learning as we go, so to speak, but I think that's the most important message, is that access to healthcare is still available. It's safe. You don't have to come in. You can now do it online or over the phone. And then testing is widely available throughout Travis County. And especially for our most vulnerable populations, we do have, I think you have a slide with the locations of the community care testing, but they're also available on our website at communitycaretx.org. And also if you follow us on Facebook or Twitter, then we're constantly posting updates there as well. Thank you.
Thank you, Isela. I appreciate it. And so those slides are going up with the community care COVID testing sites. Next, we have Edwin Marty. He is the food policy manager for the City of Austin's Office of Sustainability. He has years of experience in implementing sustainable farming practices all over the world, as well as urban farming initiatives here in the US. Edwin, we're happy to have you.
Thanks so much. I'm going to walk through a couple of resources that you and your family might be able to utilize to get food, and want to just quickly recognize the incredible challenges that so many in our community are having due to the pandemic and the economic downturn. The closure of businesses has had a dramatic impact on people's ability to make money and pay for basic services. And we at the City of Austin are trying to do everything we possibly can to decrease the impact of that on you and your family. And we're really aware that a lot of people have lost their jobs and are not able to access the resources that they perhaps were able to before the pandemic hit. So we've been working closely with a lot of organizations throughout the city to increase food distribution opportunities. And I'm excited to say that the simplest way to get access to food resources is to call 211. Again, 211 is a hotline that's set up by the United Way, and they have the latest information around emergency feeding locations, hours of operation, etc. So all you have to do is call 211, and they have specialists standing by to answer your call and direct you to resources regarding emergency feeding locations. They also have translation services available in multiple languages, Spanish, Vietnamese, Chinese, etc. So please utilize 211. And then if you have web access, you can visit connectatx.org. That's a parallel website to the 211 call line managed by the United Way. Again, it's connectatx.org. And it's got lots of great information about emergency feeding locations where you and your family can go and pick up free food. It's got the latest information regarding hours of operation and any changes of location for those meals. Also want to point you to austintexas.gov. the City of Austin's website, /COVID-19, a tremendous number of resources, including food access resources. So please, if you haven't already, and you have web access, please visit austintexas.gov /COVID-19. And then lastly, I want to point out the Central Texas Food Bank.org. Central Texas Food Bank is our wonderful nonprofit partner here in Central Texas that provides food for food pantries throughout the area, as well as provides direct service to you and your family. Their website has a wonderful button at the top called Find Food Now. So if you visit centraltexasfoodbank.org, you click on the Find Food Now button, and it'll help you find the closest location to you for emergency food. But in addition to those three websites, I want to walk through a couple of other quick resources for you and your family. Children are especially vulnerable during this economic downturn, and fortunately, there's a number of ways that you and your family can get resources. The federal government developed a program called Pandemic EBT. On the flyer, you can see on the screen currently, Pandemic EBT is basically just a one-time benefit that you can get to help you feed you and your family. If your child is enrolled in a school that is a free and reduced lunch school, you're immediately eligible for this benefit. If you're currently enrolled in Lone Star Card or the SNAP program, this benefit will be automatically applied to your Lone Star Card. It's a $285 per child benefit. So hopefully, if you're enrolled in SNAP and your child is in a free and reduced lunch school, you've already received this benefit. You have a couple more days to sign up for this benefit if you have not already received this benefit. Even if you're not enrolled in Lone Star SNAP benefits, you can still be eligible for this program if your child is at a free and reduced meal school. So you can call 311. It's the easiest way to get information about that benefit. Again, just call 311 and there are operators standing by to help you figure out how to move forward with the enrollment process. But again, that enrollment period ends June 30th. So you've got about 3 more days to enroll in the program. And it's a $285 per child benefit that you can get to help offset costs of feeding your child while schools are out. In addition to the Pandemic EBT program, there's a couple other ways that you can get food for your children. The Central Texas Food Bank has a whole series of summer meal programs where you can swing by locations and get breakfast and lunch for your children. You'll need to provide proof that your child is enrolled in the school, but outside of that, you'll just be able to drive in or walk up and get free breakfast and lunch. You can visit the centraltexasfoodbank.org website, /free summer meal kids, or just click on the Find Food Now button on the Central Texas Food Bank site, and it'll take you to where those summer meal programs are. In addition to the Central Texas Food Bank summer meal programs, local school districts are also providing summer meals. Austin Independent School District, Del Valley Independent School District are both providing both meals that you can drive up and pick up for your student or your child, as well as for you. So these meals are called caregiver meals, and both AISD and Del Valley are providing those on a daily basis, Monday through Friday. Swing by a local school and you should be able to get breakfast and lunch for your child as well as for yourself. And that program will continue throughout the rest of the summer. In addition to summer meal programs for students and children, there's also a number of programs available for seniors. Meals on Wheels is a wonderful nonprofit agency here in Austin that's been providing meals for seniors for many, many years. They've done a great job of expanding their services and are doing everything they can to get meals delivered, prepared meals delivered, as well as groceries delivered to seniors who have limited mobility. You can visit Meals on Wheels, centraltexas.org to get more information about how to get enrolled in that program. They're doing everything they can to reduce the wait list for enrolling in that program, and we're excited to say they're very close to reducing their wait time to almost nothing. So again, visit Meals on Wheels, centraltexas.org for more information. There's also a wonderful new nonprofit called Good Apple Foods that is providing prepared meals delivered as well as groceries delivered to seniors and anyone who has been infected with COVID-19 or having to quarantine as a result of family members being infected. GoodAppleFoods.com is a great way to enroll in a free program to get meals delivered to you and your family members. Lastly, I want to touch on a couple of other general resources. Our City of Austin Parks and Rec Department has a number of free programs where you can come by and pick up free food. The Gus Garcia Recreation Center in North Central Austin is providing free produce distributions every Wednesday at 10 a.m. while supplies last each morning. So simply drive up to the Gus Garcia Rec Center or walk up to the Rec Center and you'll be able to get both free produce boxes as well as prepared meals. Lastly, I want to touch on a wonderful other program. Local farmers markets have an initiative called the Double Dollar Program, where if you're enrolled in food stamps or SNAP eligible, you can go to a local farmers market and get 2 for 1 on fresh produce, fresh locally produced produce. So anyone who's enrolled in the SNAP program can simply show up at any farmers market, and every single farmers market has a booth set up to help you find how to get the 2 for 1 benefit for fresh locally produced foods. So hope these resources have been helpful, and we'll be continuing to provide the latest information. Again, please call 211 as the easiest possible way to get the latest information about where emergency feeding locations are. Thank you.
Thank you, Edwin. A lot of food resources available, so I hope that people are getting their needs met. Next, we have Israel Badillo. He's a community worker with Austin Public Health, and he's been working in community health and wellness for over 7 years. He'll be talking about housing and rental and utility assistance. Thank you, Israel, for being here.
Thank you for having me. So like was said, I work with Austin Public Health, specifically in the Neighborhood Services Unit. And we've sort of changed our focus from a lot of the other duties that we were doing to focus mainly and predominantly on rent and utility assistance. We recognize that right now that rent and utility was an issue that was impacting a lot of our communities even before COVID. And now that a lot of our communities aren't being able to work, a lot of people are being made to stay home. That our communities, especially those who had low income, are having difficulties making their rent payments and their utility payments. We've set up a phone line for people with Austin Public Health through the neighborhood centers that they can call if you have questions about your rent. The phone number is 512-972-5780. And so what will happen is that you can call that number. We'll do a quick intake with you, and we'll determine, based off of our eligibility, with the new funding that we have with COVID, our eligibility has been brought up to 200% of FPL, which means that we're able to help a lot more people than we were previously. And we set up our system to all be digital, so all of our forms will be either emailed to you or mailed to you, depending on your comfortability. And then once we get those forms back, we'll be able to work with you around scheduling an intake appointment to see what we're able to help people with. In that same vein, we're also working with our community partners at Austin Energy and with Catholic Charities to start providing some utility assistance as well. So the Austin Public Health is part of Austin Energy's +1 program. So City Council has authorized additional funding for the +1 program through September and increased the amount available. So we're able to help people a little bit more with the rental and utility assistance programs. And with the +1 program, you can see the number now at the bottom. You can reach out to call that number, or you can also call the number that was posted that I mentioned earlier around the rental assistance program. To reach out to Austin Public Health around rental assistance. The great thing about the customer assistance program, which is a different program, the +1 program, is that we're able to assist more people through that, and the discount has been increased. Customers don't have to pay the $10 a month customer charge. There's been a lot of changes that have happened to our programs, specifically because of COVID and because we want to be able to assist people easier and in a way that is still recognizing that social distance requirements. Yeah, that's what I got to say about that.
Well, thank you, Israel. I do want to mention that FPL stands for the Federal Poverty Line. So, and you can see the slide for the utilities assistance information and all information that gets covered here, the phone numbers, the websites. We'll make sure to share that with the video after we have finished the live event. So thank you for those questions and comments. Our next panelist is Ellen Richards. She serves as a Chief Strategy Officer for Integral Care, overseeing the areas of strategic and community planning, resource development, government affairs, communications, and community engagement. Over the past 2 decades, Richards has developed in-depth knowledge of health and human service issues in Central Texas through her work with the City of Austin, Travis County, and Central Health. Thank you for joining us, Ellen.
Good morning. So glad to be with everybody and learn about all the amazing work that's happening across the community during this difficult time. I work at Integral Care. We're a local government agency, and we provide services for people with serious mental illness, substance use disorder, and intellectual and developmental disabilities. We've been in this community for 50 years. We have continued to provide services throughout the pandemic, and will continue to do so. Many of our services have been moved to telehealth or telephone services, but all services are available. And all of the services that we provide include our 24/7 crisis support line, and that's available to anyone in the community to call at any time who needs immediate emotional support or is experiencing a psychiatric crisis. We also have psychiatric emergency services, which is available on an appointment basis. And that's, again, for someone who is in crisis. We also have mobile crisis response that can go to anywhere someone needs help. Additionally, we have ongoing counseling and mental health support services, and we provide drug and alcohol treatment as well. We also do quite a bit of work across the community with people who are experiencing homelessness and help them move into housing to regain independence and provide supports to help them with stabilization in housing. For people who are living with intellectual and developmental disabilities, we help people transition to the community to regain independence, often with supports, get the supports they need, and then also access employment if that's something they desire. We have a wide range of services, and during COVID, the best way to access care is to contact our helpline. And if you could go to the next slide, that would be helpful. That number is 512-472-HELP or 4357. Again, this line is available 24 hours a day, 7 days a week for anyone in the community that's needing immediate emotional support, or even if you're concerned about a friend or family member. Additionally, you can access information about our services at this line and also get appointments for services. While our services are available, we are making appointments for any face-to-face visits that might be necessary. So call this number, again, 512-472-HELP, in order to make an appointment and access services. We're here for you and for your family members anytime you need help. If you would like more information about Integral Care, please visit our website at www.integralcare.org. And there is also a specific COVID page on our website that has more detail about service access. Counseling services are being provided at our East 2nd Clinic. And we also have crisis residential services available in 2 locations. And again, the remainder, we do have psychiatric emergency services open by appointment. And then the remainder of our services are predominantly being provided by telephone or telehealth. Thank you so much, and I hope everyone stays well and healthy out there.
Thank you, Ellen. That's extremely important information. We appreciate you sharing that with everyone. Last but not least, we have Laura Pivito, the Division Director for Office of Children's Services with Travis County Health and Human Services. She has more than 31 years of experience working in the social service field with a specialization in child welfare and mental health. Thank you for joining us, Laura.
Thank you, Mayor, for having me today. I'm excited to be on this panel of experts and community individuals who are extremely concerned about the well-being of every resident in our community who's been impacted by this pandemic. It's been a very difficult time for all of us, and coming together across systems and across our different entities is going to allow our community to come together and come out of this pandemic in a successful way. But to do that, we have to make sure we have access to services and supports to our community. And we heard from others regarding those supports and services. And I, like Israel, have services that focus on food and rental and utility and mortgage assistance. So I'm going to take you through what Travis County Health and Human Services has available for community residents. We have 7 community centers that are listed on the screen. The centers are located throughout our community for easy access for residents. Our centers serve everyone in Travis County, whether you reside in the city of Austin, or you reside in Manor or Del Valle or Lakeway or Jonestown. You can access any of our community centers for support. Next slide, please. These are the specific addresses, phone numbers, and email addresses for the different locations. Again, a resident of Travis County can go to any one of these centers, or of course, go to the center that's closest to you. When you are accessing a center, you're going to be able to access food pantries, rental and mortgage assistance, or utility assistance. During COVID-19, we have really focused all of our attention in providing those resources, since those seem to be the ones that are most important right now for us to weather this very difficult time during the pandemic. Next slide, please. So the Travis County Community Centers are open Monday through Friday from 8 to 5. But due to COVID-19, all the services are being completed through telephone, online, or by appointment. So we're not accepting walk-ups, and that's to keep you safe and to keep us safe so we can continue to deliver the services to the community throughout the pandemic. You again can choose any location that is most convenient to you, and then call and let them know what service you're looking for, what supports you need, what your concerns are, and they're going to help you navigate to the right support and services. If Travis County cannot provide it, we're going to help you find that service in our community. Now, there are a lot of people in need currently. It's been a very difficult time for many, many families. So the wait times on our calls could be a little longer than we would like. We're working very hard to shorten that time so that you don't have to wait, but you may find that you're waiting for a few minutes. Calls rotate quickly. As we move off one call, we pick up the next call. So please use the numbers that were provided in the prior slide to access the community centers and to inquire on exactly how you can get the support and services you need. We're focusing on food pantries, rent or mortgage assistance, and utility assistance. First, we're going to talk about food pantries. Next slide, please. Well, that's not the next slide.
Laura, I think we removed the slides in interest of time, but please feel free to cover your talking points of food pantries.
Okay. I'll be quick. So as it relates to food pantries, the county is providing 3 meals a day plus snacks for all household members for 5 days. There's a variety of food options, including proteins, boxed and canned foods, and healthy options. There's no documentation required, and no one is turned away for a food pantry. They're distributed by appointment only. So, and each appointment's about 15 minutes. So you call the center closest to you, you schedule your appointment, and then you arrive and you will be given your food pantry. At that time, you can also request a fan. You know, it's getting hot out there in the summer months. So if you need a fan, request that, and it'll be provided to you along with your food pantry delivery. Additionally, Travis County is providing utility assistance, as is the city of Austin. We provide utility assistance for all individuals that reside in Travis County. We have 9 different grants that we access to assist residents. We've had increased funding due to COVID-19, so we are able to help more people across our community. So again, if you need utility assistance, we do not want anyone to have their utilities shut off during this time. Please call us. Let us help you. Let us help you get your application in place so that you can keep your lights and water on during this time. And then finally, we have rent and mortgage assistance. We are providing this assistance. We have COVID-19 CARES Act funding, which allows us, as it does the city of Austin, to support those who are impacted by the pandemic, who have lost their jobs, or are unable to make their rent. We're able to pay up to 3 months of fair market rent or mortgage payments. And there's increased eligibility for families. So you need to call to see if you need this help, you may qualify. The funding focuses directly on those impacted by COVID-19, and you have to meet the federal eligibility requirements. But we'll help you navigate that. You don't need to know it. You just need to call us if you need help. Finally, we also have other funding available through different grants and local funding to pay for mortgages and rent for those who do not qualify under COVID-19. So again, if you have a need, you need to call us, let us help you navigate through our systems and get you connected so you get the resources you need to weather this pandemic in the most successful way possible. Thank you, Marion.
Thank you, Laura. Very, very helpful information about the Travis County Community Center outside of the central city of Austin. I do want to stay on comments and questions. So we have been receiving comments as our speakers were presenting. And so, but before I get to any of the questions, a lot of the comments have to do with sharing this information. A lot of people really want this information. That's great news. Facebook does record this video, so the video will continue to be shared on APH Facebook's page. We will look to see how best we can share the slides, attach them in some way to the Facebook video so that you have access to the slides. Additionally, if you are looking for other information that was not covered during this panel discussion, you can always visit www.austintexas.gov. And always call 211. It's a directory of services and they serve multiple languages. Or also visit connectatx.org and you can navigate a directory of services in the Austin-Travis County area as well. So for our first question, I'll direct this to Dr. Douglas. Someone was mentioning that the topic of while you're feeling any symptoms is a bit difficult because the symptoms aren't so clear cut, the symptoms for COVID. So they're having a hard time kind of really knowing when it's okay to go about as business as usual. Dr. Douglas, I don't know if you have any input or insight into that. You are muted.
Sorry. That's a very good question. And it is a hard reality about COVID is that it doesn't have classic, I mean, we know chest pain and shortness of breath and a cough with a fever is very worrisome of COVID. And the reason it's very worrisome, if you have a flu-like illness, that it makes you think you have COVID because we do not have flu right now. In fact, in the summer, we really, don't have any other major cold virus that's going. So what's difficult is when patients might just have a headache. We have hazy weather today and they might think it's their sinuses. But if it's something out of the ordinary where it's not your typical allergic rhinitis, congestion, and you're having a headache, you need to worry about COVID. Also, a sore throat could be strep throat. That's true. But you have to, worry about COVID because we're seeing a lot of it. So that's the more predominant disease that we're seeing. I've had various patients that come in with fever and diarrhea as their symptom, and they don't have respiratory symptoms, and they were COVID positive. So it's a great question, and it's hard. There isn't, you can't say this is a classic presentation or I don't have it. You just have to worry about it. And I think right now, because the numbers are so high and for the sake of people around you, it's better that you think about that you might have COVID and take precautions until you're able to get the result of the test.
Thank you, Dr. Douglas. I will mention that APH is using the CDC's symptom-based strategy, and that encourages people to quarantine for at minimum 10 days, and then they must also pass at least 3 days with recovery of symptoms. We do encourage everyone to get tested. We have a question for Laura Pivito about the Travis County rent assistance. Are the 3 months paid upfront, or does someone need to apply for each month? Please unmute yourself.
Sorry, it took me a moment to find the mute button. So that's a great question. And when you submit your application, that can pay for all 3 months consecutively to care for your back rent, or can also cover your cost of rent going forward. So your eligibility is based on the documentation you submit, your current situation. So the center staff will be able to help navigate that with you and figure out exactly how you can best use the COVID-19 CARES Act benefit to serve your family. So there are options and some flexibility associated with it. And so we want to make sure we get you the best benefit you can. So by calling, we'll be able to navigate. But certainly families are going to be eligible, if they meet the requirements, up to 3 months of rent or mortgage coverage.
Maren, can I jump in real quick to talk about how that's different from the City of Austin's program?
Yes, please.
So the City of Austin can only assist people with back rent. So we can only assist people if you're already behind on your rent. We won't be able to assist you moving forward into the future. But it doesn't. We don't have a time limit that you can be back late on your rent. Like we can go further back than 3 months. It just depends on how much you're currently behind, and we're able to assist you with. If that makes a little bit more clear about our program. And also with our program, I forgot to mention earlier that with our current funding, we're only able to assist people that are in City of Austin proper. So we're working closely with Travis County and with Catholic Charities and a few other local agencies to same thing like Laura said, if we can't help you, we'll find someone who can, because our funding is right now currently limited to City of Austin.
Thank you. We're also having questions about community care services, and while we don't have a panel community care with us, we know that community care in general serves uninsured populations. Isela, I don't know if you have any more information about how individuals who don't have insurance or don't necessarily know how to navigate that situation, what they can do to receive service.
Hi, Martin. Yes, if an individual doesn't have health insurance, they can either apply, and if they're a Travis County resident, they can apply for the MAP or MAP Basic programs, which the income limit for those programs is up to 200% of the federal poverty line. Now, if someone is above that income or they live outside of Travis County, Community Care does have their own sliding fee scale program, and it is not limited to Travis County residents or to that 200% of federal poverty line. So if they would like to apply directly with Community Care, then they would call 512-978 9015. And that phone number is also on the Community Care website and on the flyers that you showed earlier, so that they can get directly enrolled with them. But the programs are available to our uninsured populations. Anyone who lost their coverage also due to COVID-19 and closures, and who's been, for example, on either private health insurance or ACA health insurance marketplace plan, they may also want to report that change to the marketplace, because they may either qualify for greater tax credits to make it more affordable, or they may want to enroll for the first time if they lost their private plan, and now they would have 60 days from their date of losing their coverage to enroll in a health insurance marketplace plan.
Thank you. And per a couple of the other questions on community care, the COVID testing sites for community care are accepting walk-ups if you're not able to drive up. You don't need a previous appointment, and those are changes to previous arrangements that they had. You don't need an appointment, and you don't need to be showing symptoms for community care to test you. But they are switching over to, many sites are switching over to morning hours to avoid the heat. So from 6:30 a.m. to 1 p.m. Edwin, we also had a couple of questions about the food access materials. Do you know if there's any possibility of an extension on the pandemic EBT program? Or if not, what other programs can people access?
There's currently not any discussion about expanding the pandemic EBT program beyond the initial program. So unfortunately, that one-time benefit, the deadline will be June 30th. There is a fair amount of discussion nationally about why it would be a good idea to create a second round of pandemic EBT, especially as we see the infection spike. But currently, the federal government is not considering that. But with greater advocacy, we could push them to. And so certainly part of my job at the City of Austin is to let our elected officials know, to pass that word on up to help create advocacy. That said, the absolute best thing to do is to call 211 and go and get the resources that are waiting for you and your family. 211's got the latest and greatest list of emergency feeding locations. So unfortunately, probably not another round of pandemic EBT anytime real soon, but we'll see. We're doing everything we can to advocate. But in the meantime, please just call 211.
Thank you, Edwin. We have another question on the renter's assistance. Does someone, and this might be true for all the other services, do undocumented individuals qualify for the renter's assistance programs? And if anyone wants to mention if their programs are also for undocumented individuals.
So this is Laura Pivito with Travis County. And I first want to clarify the original question, because when I heard Israel's response, it made me realize that I might have misspoke, unfortunately. So as Israel indicated for the city of Austin, Travis County is paying 3 months up of back rent. So if you are behind in your rent, we can pay up to 3 months of that back rent, and we can pay that up through November 30th of this year. And the eligibility has increased to those individuals that are at 250% of the federal poverty guideline. So it's an increase of individuals that actually qualify. So if you're behind on your rent, you're having difficulty paying your rent or your mortgage, you're a resident of Travis County, you can certainly contact us and we can provide you support potentially through the CARES Act. Travis County also has funds that are available to them that is not specifically federal dollars, that are local community dollars allocated through the Commissioner's Court. And those dollars can help all residents if they qualify, regardless of their documented status.
It's the same with City of Austin Public Health. We do not take into account someone's immigration status when determining whether to provide assistance. As long as the client can provide a lease agreement with their name on it and some additional documentation, we can assist them.
And I will say that's the same for most of the food access, emergency food access programs that are available in the region. Those resources are available regardless of immigration status. In addition, the pandemic EBT program is available for all students who are enrolled in a school, regardless of your immigration status. So we encourage you to call 211, find out where the local emergency feeding location is, and most of those do not require any documentation whatsoever.
Thank you.
And I'll add that for MAP, you do not have to be a citizen or permanent resident. And for testing, you do not have to have a picture ID or be a citizen or or a resident? Sorry.
And for integral care, we serve people based on their need and diagnosis, and regardless of what your status is.
Great. It sounds like many of our individuals, regardless of immigration status. I will give the last question to Dr. Douglas because it's more of an emergency situation. I don't know if Dr. Douglas can answer to this, but someone is asking about, they're hearing, I guess, on the news maybe that the hospitals are filling up. And what would you recommend for people who are having breathing problems? Where can they go for service?
You're on mute.
So if somebody's having breathing problems, that is an emergency, and they probably need to call 911 if they're, they're driving themselves in. The hospitals are available, and they're doing a great job in moving patients. In at least in Austin, we're concentrating the care of COVID to certain hospitals, and so they're shifting hospitals, but their hospital care is available. ICU care is available. It's reaching a serious number, but the administrators are really working on increasing staffing, and to make sure that every hospital is able to provide care. Some hospitals, for example, if you arrive there, let's say you call 911 and they bring you there and they determine this is a hospital that is taking care of COVID positive patients, but they think you need to be admitted, they may take you to another hospital. But the care is there, so don't stay at home. That was something that happened that was really sad, that a lot of people stayed at home with heart attacks. And those individuals, if they survived, are going to have long-term complications that could have been prevented. The same as a stroke. It's really important that when you're having those symptoms of emergency that you do go to a hospital. They will take care of you, and it's safe. You may get transferred to another hospital, but the care will be provided. We're not in that bad of a situation, and I don't think we'll get there. I think it'll be very difficult, but I think we're going to be able to care for our Austinites, the medical community.
Okay, well, thank you all. We are reaching an hour streaming, so to thank all of our panelists for their presentations. I will say that if you have any questions or comments that you would like to phone in for those individuals that were calling in or people who prefer to leave voice messages, you can call and leave a comment today at 512-974-9410. Again, that phone number is 512-974-9410. That's for individuals that perhaps didn't want to type in a comment or a question or have a follow-up comment or question. We will see how best we can provide the answers in a follow-up, either virtual forum or make sure that that information, these answers are getting answered and that the public has access to this information. I do want to give a special thanks to our sponsors, Ascension Seton, Austin Public Health, Austin Transportation Department, Capital Metro, Central Health, Dell Medical School, Integral Care, St. David's Foundation, Travis County Health and Human Services, University of Texas School of Public Health at Austin, Community Care, City of Austin Office of Sustainability, El Buen Samaritano. Thank you all for being here, for joining us today. Any questions, again, that weren't answered, we will try and get those answered and get shared along with the video. Any resources not covered, please call 211. Okay, thank you so much.